An abdominoplasty, or a tummy tuck procedure, is a surgical operation which removes excess loose skin from the tummy, as well as tighten the abdominal muscles at the same time. The best candidate for an abdominoplasty is a lady who's had several previous pregnancies, who decided not to have any more children, who has got a loose stomach, loose muscles, and loose overlying skin which hangs down in the form of an apron, who's otherwise quite fit and well and thin, and is a non-smoker. The people who should avoid having an abdominoplasty, on the female side, women who plan to have more pregnancies should be discouraged from having the procedure until they've had their full quota of children. Heavy smokers should be discouraged, as well as people who are not medically fit. During the consultation, you'll be asked to fill in a medical questionnaire which will outline your medical history. In particular, the surgeon will be looking for any incidences in your past medical history which may preclude having surgery, such as any previous heart conditions, chest conditions, any bleeding or clotting disorders. Once you've completed your form, the surgeon will go through your medical history in great detail. Once he's happy that you seem medically fit, he will discuss the procedure in great detail with you and discuss all the possible post-operative complications and sequelae. Make sure that you understand them, because it's not an operation to be undertaken lightly. And once you understood all that, he should give you plenty of written information once he's answered all your questions, to go home and again make an informed decision to proceed. The best way to prepare for this procedure is to do as much background research as possible. That includes research on the internet, reading up about it as much as possible. There are several books available on the procedure. And once as much knowledge as possible is gained, then is the time to go and discuss this with the operating surgeon, as this will make your consultation much more meaningful, and you'll be able to understand all the smaller points which go to help make your mind up as to whether you should proceed with it. All your questions should be answered by the surgeon, and you're encouraged really to make a list of any questions, because at the time of the consultation most people are nervous and they'll get a blank and they will forget what they wanted to ask. So it's also important to choose your surgeon carefully and make sure you're happy with the surgeon that you're seeing, and if you're not happy with one, then go and see another one, or even more than one. Once the patient is asleep and the surgeon's made his incision, the skin and the fat is then lifted, dissected from the abdominal muscles, and is dissected all the way up to the rib cage. A circular incision is then made around the belly button, and the belly button is freed from the surrounding skin. The muscles are then tightened with non-absorbable stitches, and once that is done, the skin and the fat is stretched all the way down to the incision, to the original horizontal incision line. There is then an opening is made halfway between the bottom of the rib cage and where the incision line is, and the belly button is brought forward and sutured to the skin. The excess skin and fat is then trimmed, and the incision is then closed in layers. The normal length of time it takes to do a full abdominoplasty is between 2 and 3 hours. It depends on the gravity of the situation, how much skin and fat there is. Obviously varies from patient to patient. It is true to say it's probably one of the most severest pains that you can get in cosmetic surgery, because for the simple reason that you're closing everything under tension. You're closing the muscles under tension, you're closing the skin under tension, and that in some people can give rise to fairly severe discomfort. But luckily we can alleviate this with appropriate medication. So after the first 24-48 hours, patients should feel quite comfortable.